The USMLE Step 1 exam covers a number. The USMLE Step 1 exam tends to have a number of questions concerning inflammation and neoplasia as applied to different organ systems. For example, a common topic is myocardial infarction, which requires knowledge of the associated inflammatory response. For this tutorial, we focus on two primary pathological responses of disease, namely inflammation and neoplasia, as well as repair mechanisms for when tissue injury takes place. We begin with an overview of the processes underlying inflammation. Inflammation is a response of the innate immune system that is characterized by fever and inflammation. When tissues become injured, the typical response is inflammation, a series of responses that is initiated by mast cells embedded in connective tissue that release a number of pro-inflammatory cytokines and chemokines, including histamine and leukotrienes. These agents cause local blood vessels to dilate, which allows for an influx of immune. The inflammatory process is manifested by redness, pain, heat, swelling, and loss of function. During the inflammatory process, there is fluid exudation via vasodilation, increased vascular permeability, and endothelial injury. There is also leukocyte activation with emigration, chemotaxis, and phagocytosis. Acute inflammation is mediated by neutrophils, eosinophils, and antibodies. In contrast, chronic inflammation is mononuclear cell mediated, distinguished by continuous destruction and repair. Granulomas made up of nodular formations of epithelioid macrophages and giant cells fit into this category of chronic inflammation. Fibrosis involves transudates and exudates are seen in the inflammatory process, and their distinction must be known. A transudate is caused by disturbances of hydrostatic and/or osmotic pressure with sodium retention. A transudate is hypocellular, protein poor, and has a specific gravity less than 1.012. This is not an inflammatory process. In contrast, an exudate is caused by lymphatic obstruction and inflammation. An exudate is cellular, protein-rich, and has a specific gravity greater than 1.020. Now let's take a closer look at leukocyte extravasation. In regions of tissue injury and inflammation, neutrophils exit blood cells in 4 phases: rolling, tight binding, diapedesis, and migration. In rolling, carbohydrate ligands on the surface of the leukocyte bind to selectin molecules on the endothelium, slowing the cell down. The next There are a number of chemical mediators of inflammation that are derived from plasma, leukocytes, local tissue, and bacterial products. These mediators have short half-lives on the order of seconds to minutes and can have either local or systemic effects. Some functions and examples of chemical mediators of inflammation are vasodilation, caused by histamine and nitric oxide; increased vascular permeability, caused by histamine and bradykinin; vasoconstriction, caused by thromboxane A2; pain production, caused by bradykinin and prostaglandin E2; fever production. Now that we have reviewed inflammation, let's take a closer look at the mechanisms of cellular injury. With cell injury, certain processes are reversible, while others are irreversible. Among the reversible cell injury processes are cell swelling, fatty change, decreased ATP synthesis, glycogen depletion, ribosomal detachment, and clumping of nuclear chromatin. Irreversible cell injury processes include plasma membrane damage, calcium influx, lysosomal rupture, mitochondrial permeability, and nuclear karyolysis, karyorexis. Free radical injury may be caused by a number of processes. some of which include radiation exposure, metabolism of drugs, leukocyte reperfusion after anoxia, redox reaction, nitric oxide, and transition metals. Free radical injury causes cell injury via membrane lipid peroxidation, protein modification, and DNA breakage. Free radical degradation is achieved via enzymes like catalase and peroxidase, antioxidants such as vitamins A and E, and by spontaneous decay. The body may use the power of free radicals to kill bacteria. Bacterial killing may be oxygen dependent or oxygen independent. The oxygen-dependent myeloperoxidase or MPO system is present in neutrophils and monocytes, but not macrophages. It involves the production of superoxide free radicals, peroxide, and bleach. Deficiency of NADPH has an antimicrobial effect. In the oxygen-independent system, bacteria are killed by substances such as lactoferrin and major basic proteins located in leukocyte granules. Cell injury frequently leads to cell death. Apoptosis refers to programmed cell death and is characterized by cell shrinkage, membrane blebbing, pycnosis, which is condensation of chromatin, karyolysis, which is nuclear fragmentation, karyorhexis, which is DNA fragmentation, and formation of apoptotic bodies, which are phagocytosed. No significant inflammation occurs during this process. Apoptosis occurs naturally during embryogenesis, as well as during immune cell-mediated death. The counterpart to apoptosis is necrosis. Necrosis refers to the enzymatic destruction of a cell due to an exogenous injury and is manifested by enzymatic digestion and protein denaturation with subsequent release of intracellular components. Necrosis is an inflammatory process. Necrosis occurs morphologically as liquefaction necrosis in the brain, coagulative necrosis in the heart, kidney, and liver, fat necrosis in the pancreas, fibrinoid necrosis in blood vessels, gangrenous necrosis in the GI tract or limbs, and caseous necrosis in tuberculosis. Amyloidosis is a condition in which amyloid proteins, which are insoluble and form in beta-pleated sheets seen pathologically, are abnormally deposited in a variety of tissues, giving them a waxy appearance. The types of amyloidosis are primary amyloid, consisting of the AL protein derived from Ig light chains, as seen in multiple myeloma. You can remember that AL stands for light chain. Secondary amyloid consists of the AA. Resolution of inflammation refers to the restoration of normal structure at the gross and cellular levels. In the normal process of restoration, granulation occurs, which is the formation of very vascularized fibrotic tissue. Other more severe conditions that might occur are scarring, which is altered structure and function due to the deposition of collagen. Fistula formation, the formation of an abnormal connection between Next, we will review mechanisms by which the body repairs itself. Factors involved in tissue repair include parenchymal cell regeneration and repair by connective tissue or fibrosis. Parenchymal cell regeneration depends on a number of factors, including the ability of cells to replicate. Labile and stable cells can replicate, but permanent cells cannot. Examples of labile cells include epidermal stem cells. Examples of stable cells are fibroblasts, and examples of permanent cells are myocardial cells. Parenchymal cell regeneration also depends on factors that stimulate parenchymal cell division and migration, such as growth factors, hormones, and interleukins. It also depends